to come in and have a massage, that maybe you're not going to be able to help yourself anymore and that you could use a little bit of a professional touch. So if there's any areas that any of you would like covered, just let me know. So before we start, is there anything in particular that any one of you is looking to learn about, hear about, or you're just interested to sit down and have a class?
Anything to address knee pain, or maybe arthritis associated with knee pain or anything like that.
Okay. You're a little young for arthritis though.
3 surgeries, ACL, all that stuff, sort of sped things up a bit.
Okay then. He sounds like he's worse off than the rest of you.
Sports?
Yes, yes.
Yeah, my nephew's going to playing hockey.
Soccer and hockey, yeah.
Yeah.
So,
Oh, sorry.
yes, it's okay. It's okay. I heard neck and shoulders and Denise. So not Denise, I heard Denise, you know, it's okay. So, all right, so the idea is that when you've had an injury, there's several phases that you go through. You've got the acute phase, which is the first 24 to 48 hours of an injury. And then from there you move on to the subacute phase, which can last for up to a week. And then after that you can consider yourself in a chronic phase. So what's happening with that is the subacute is when you've first done it, you've got the pain, inflammation, the reduced movement. The reason all of those are there is so that you'll stop causing more injury. You've done some kind of damage, there's some trauma that your body says, just rest, take it easy, don't do a lot. Massage therapy in that sense, when you're doing things, it's not as beneficial because you're already in an aggravated state. So these are times that you're going to want to do things for yourself at home those first 24 to 48 hours. Make sure you stay on top of it. So this is when the rest, ice, compress, and elevate. So that's the RICE acronym that we use. So you want to make sure that if you've done something, you're taking and you're realizing the situation you're in, taking the load off, sit down, don't do anything for a while. Ice it periodically. We usually say 10 minutes on, 10 minutes off. You can do that for an hour in a cycle a couple of times a day. Compressing it, that's the idea where you wrap it so that the swelling can't increase. And then you want to elevate it so that you're not increasing the injury. At that time, you can be using different products that you've got. You see all the different muscle creams and rubs and things like that. If you choose to do that, or any of the anti-inflammatory painkiller medications, those are the first things that you can really do. It's not a time that a massage therapist can really get in and do any kind of a treatment. So that's what you'd want to do for yourself at home. And the chiro is here just to mock me today, so everybody knows. He's a plant, he's putting in questions just for fun. So then once you've gotten past those first 24 to 48 hours, your system is starting to recover on its own, and you want to do things that are going to support that and promote that. So the idea of doing some self-massage at home. So this is what some of these are for. So the ball in itself, you can use this if you've got an area that you can't reach with your hand or you're not strong enough. I was showing one woman today, she's got a lot of chest discomfort, so you can compress it and roll it around. You can just put it in one spot. If you're trying to increase strength, it's something that you can grip. So the idea is then you've gotten into wanting to maybe massage yourself with your hands. So this is the area where you can use any of the creams. I always suggest just talk to your pharmacist so that if you're going to pick something that's already got like the capsaicin in it, if there's anything with Advil, or some of the creams have aspirin in them, to make sure whatever you're combining. I had one client use something and then he went into a tanning bed and he missed the part where don't apply this before applying heat, and he blistered. So it's one of those things that you have to stay ahead of and make sure that you're using the right products. When you're going to do some massage for yourself at home, anything you can eat, you can massage with. So if you don't have a massage product in the house, you can use a canola oil, a corn oil, grapeseed, things like that, coconut, olive oil. So if you're trying to do some treatment on yourself at home, any of those things would work. Basically, any principles for massage for yourself that you want to stick to is starting closest to the trunk. So if you're going to do any kind of work, you said on your neck and shoulders, you want to make sure that you start close and you work your way if you're going to go down the arm and do anything. And as well with the neck, you want to make sure that you don't work both sides of the neck at the same time. You've got the carotid artery, which is the blood supply for your brain. So if you were to pinch both sides at the same time, you risk causing more damage to yourself. So I would avoid that one for sure. Otherwise, generally with the massage, the principles that we work with from the clinic, if you thought of somebody's back, you would work generally the back and then you can work into a very specific area and then back out again. And it's similar with the pressure. You're a very light pressure, you can work down into a deeper pressure and then lighten up again. So the ideas with that are, you don't want to go, if you've got this knot that's really bothering you, just lean right into it. You want to warm the tissue up, you want to, if it's in this area, you want to do some nice broad flushing strokes through. Then you might get in a little bit more fussy onto what it is and then go back again to the very broad general strokes. The other idea is you want to start closest to the trunk and draw the blood into the trunk. Generally, you don't want to be doing anything that's pushing the fluid down. It makes it harder for your body to return it up. That's the same idea with the elevation. You've got a sprained ankle. It helps the gravity. So if you're pushing the fluid to your foot, it's going to be a harder time for the body to bring it back up again. So you want to make sure that whatever you're doing, if it was with your leg, that you start out and you just generally draw up. So your legs may not be something that you can reach as easily yourself, but if you wanted to work the ankle, you could at least start up near the knee, go down to the ankle, and then back up to the knee, always drawing towards the trunk. So that gives you guys an idea. If you've gotten into a chronic situation, somebody who has a low back injury, we suggest the stretches at home, heat before a stretch, ice at the end of your day. So this is now getting into the chronic phase. It's a condition that you're going to have that you need to stay ahead of. So generally we can give exercises, chiropractors do too. Good problem for you there. And so it works out that when you're in the chronic phase, the things that you can do for yourself at home, you can apply more pressure generally. Somebody who has plantar fasciitis, I'm not sure if you're familiar, but it's when the arch of the foot becomes very painful to step and stretch. So the idea is that before you get out of bed in the morning, you would do some self-massage, open that area up and make it more usable. So for you with your neck and shoulders, generally, let's say you want to work this side. If your arm is hanging, all these muscles are being pulled. So you'd want to make sure you're sitting with your hand relaxed, but not loaded. So into your pocket, onto your belt loop, something like that, so that it's not hanging. And then you would do the massaging through. You can do things under the collarbone and out, down a little, a nice grip. If you had somebody at home that could do it for you, the idea where they grip the shoulders and just lift a little bit, these are the upper trapezius muscles, so they can do work there for you. If you have things on the side of your neck you want to work, you might find that tilting your head to the side will relax the muscles so that you can get a bit more in them. If you were straight, the muscle is tighter, so by slacking, you might find that you can get in a few areas more. And again, just to watch that you're not doing both sides of the neck at the same time. So that gives you an idea. We have clients who have low back pain. For you, we'll get to the knee in a minute. If you've got areas, these things are great. First off, though, you don't have one. I didn't give you one because you came late. Okay. Don't leave them down anywhere that your dog can eat them. They shred into a million pieces easily. So then you have a big mess to clean up. So basically, anywhere this can be used, you've got discomfort for you, you can roll it around here. It's a little harder on the neck, but at the base of the skull, I find I've got some clients that will press there with it. If you've got the hip pain, rolling it around on the hip. Some people will lean into the wall and move around on the wall. Others will lay on it on the floor. And depending, usually in about the center of your butt cheek, there's a good spot that sometimes some people get the sciatic pain down their legs, so that can be a benefit that way. These other little guys here, this doesn't feel quite as good on small, thin areas where there's bones. So we were practicing with it today. This would be something that if you were trying to get your muscles to relax, this would be something that you could do. And so working that around. We have some clients that have knee conditions, and the muscles end up having to work harder when a joint isn't stable. So the reason that that happens is ligaments hold bone to bone. So we have ligaments on the sides of our knees, inside the knee joint, holding them front to back, top to bottom. Ligaments don't stretch. So what happens is they go out and they stay. They don't snap back. They're not elastic. So once you've taken it out, it stays there. So the person that dislocates their shoulder, it's not got the ability to stay pulled into the joint anymore. So when your ligaments start to go, your muscles have to work harder to support the joint. And also, they may be working in a different way. You can think about somebody who's got posture like this, in a comparison to posture like this. Your muscles are designed to work quite well in one position, but not so much in others. So for you, with your knees, your other body parts are trying to pick up. For gait, he's walking differently now because with the ligament injuries and maybe the cushioning pads between the knee joint, when that starts to fail, all the other areas have to pick up. So muscles have what we consider a muscle belly, which is the main bulk of the muscle. And then you can all see we've got tendons. Tendons are the extension of the muscle that helps it to attach to the bone. So the idea is that you would want to keep your muscles healthier for things you've had. Have you had a knee replacement or just
No, just ACL replacement.
Okay.
Yeah, repair.
So the idea is anywhere you've had a surgery, you're going to have scar tissue. So when you've got the scar tissue, it isn't as elastic either as a muscle should be. So then once he's gotten cut in, and it's the same as anyone who's had any kind of a surgery anywhere, as soon as they cut it, they break the fibers, and when they regrow, they don't always grow back the way that they need to so that there's movement. So that's another thing that massage therapy helps with, is returning some of that function. It's like a bent spoon. Every time you bend it over the years, if you come back to it one day, it will eventually snap. So preventing injury is a lot nicer than trying to deal with what he's doing, but at least he's functional at this point, so surgery has helped.
5 minutes.
5 minutes, okay, great. So it goes.
It goes fast.
He also was cutting them short earlier,
Okay.
which is fine. I'm okay with that. So these are different things that you would be able to use at home. If you were getting into an exercise program, these are great for retraining. So this is, again, something you can do at home if you don't have room for a gym. If somebody says you need to do a bicep curl, you could take this band, and I'll get you to hold it and pretend like you're a doorknob. I'm sorry, but what ends up happening is you want to tie it to something. So she could tie that to a doorknob. And then what you would do is you could do a bicep curl. So you don't have to own any weights, you don't have to go to the gym, and the strength of this is a very light one. They get thicker and stronger as you go. So if you're trying to do something where you're advised, you might have an activity where you're supposed to raise your arm with resistance. So these are things that you can do at home for yourselves, that you don't have to get a gym membership, you don't have to go out and buy pounds of weights, things like that. So these are also good functional things you can be doing for yourselves at home. So that, with 5-minute time warning, I'll open up if you guys have any kind of questions that you want to ask. Did I cover the neck and shoulders enough for you? And the knee enough for you? Okay, so, yes, you've got a question.
You stood sideways and you went like this?
Mm-hmm.
Okay. For 25 years I've been typing using the computer.
Yes.
And then when I retired, I saw myself in the mirror and I'm like this.
Mm-hmm.
So
in terms of things with that, if you were going to just stick with some self-care.
Get my shoulders back and my head back.
Okay, so self-care at home, first off, what's happening is these muscles across your chest are going to always be much stronger than the ones in your back. So they're going to pull you forward. So there's two things you want to do. You want to stretch these ones, because you've been working them. By doing this, you're working them. So you have to stretch out and open up. So starting out with this, where you're doing work like this along the chest, you can compress with it under the collarbone. You want to use a bit of a pressure with it. From there, the next thing you can do is take a rolled towel and put it on the floor under your spine and lay like this. So then what happens is it opens up your chest, because you spent so much time like this. Even laying flat may be a challenge for you right now. So the idea is that you want to open up and do that. Eventually some people will move up to a pool noodle roll. I'm not sure if you're familiar with the pool noodle.
Yes, I know what it is.
Okay, so you can take that and you would cut a length of it from about here to here. You want your head to rest on the floor when you're on it. And then you would run that down, and when you lay like that, so it opens your chest up this way, so that's a stretch for it. And then another one is basically at bra strap height. Lay it this way and lay on the floor like this. And then again, it curls you back. So it's preventing all of this. It's trying to correct that. So that's to stretch the front. The second thing you can do is a few exercises to strengthen the back, but until you stretch the front, you're not going to be able to strengthen the back. So that's where you can start with that. And it is something that you can do massage at home, and it's something that we do treat at the clinic as well. We see, I mean, I work like this all day too, so it's a very common problem that most of us, our profession has, is like driving to work or working at a desk or anything like that. So it's very common. So yeah. I think you had a question?
it's almost like it's right down through this area.
Okay.
And I also can go right down in farther and then maybe right down into my leg.
Okay, and do you ever have times when you step and you think your leg's not going to hold?
No, I never noticed that part of it.
Okay. In the side of your hip, we have two muscles and they attach, and one of the weaknesses that they can get causes a discomfort down the outside of the leg. So for you, try doing some massage on the outside. You might have a little bit of depression there, which will give you an idea of where you're looking for. And a little bit to the front, and a little bit to the back. So about this area here, try this, and if you need, lean into a wall with it maybe. But you might find that you've got something going in there that you can benefit from. And if it's not something that relieves on its own, it is something that you may need newer shoes, depending on how you're walking, things like that. You might have a gait issue that's causing that to increase. Do you do like a standard walking routine at all?
Yeah, I do.
Okay.
I walk a lot, yeah.
And do you always walk on the same side of the road, or do you walk with the rule of like into traffic?
Pretty well, the sidewalk.
Okay.
I go just around certain blocks.
And do you always head out the same way?
Yeah.
What sometimes can happen, if you think of a road, it's crowned so that the water flows off. Sidewalks have that too, so that the water would flow maybe into the gutters onto the road. So when you're doing that, you have one side that you're constantly, it has to reach farther, and the other side is jamming. So maybe do your route the other direction every other day, and you can still do the same route, but you need to just switch it up. So if you thought about somebody who's running down the road, they have to reach all the time, and then they're jamming the other one. So it really can put your pelvis off balance.
Okay, because when it really first started was when I was on a holiday in Northumberland Beach, and it was...
Yeah, so that's the thing, is that you're going to want to, or you can go half the distance and come back on your own path. Rotate each day, go one way, and then go out the other way. That sort of thing. And you don't realize that even you're turning the same kind of corner. If you're always going to the left, to the way they've designed the new hospital, I have one client that she's always turning to the right, and she has a bad right ankle to begin with, and it's terrible from having to corner all the time going to the right. So there's things like that we don't even realize that we're doing.
Okay,
But that,
to do stretches where we bring it up and then we bring it over, like, to see if that was helpful, but it really hasn't given me a whole lot of readings.
yeah, so try the walking routine. It may be something combined with the massage will benefit you, a combination of the two. So taking this and doing that a couple times a day. And before you head out in going on the walk, do a bit to limber it up. Does anyone else have any questions? Ignore the man that's trying to shoot me off the stage.
Ignore the man behind the curtain.
Do you have a question at all, or you're good? Okay. So yeah, so that's that basically. But just please don't let your dogs get a hold of these. I would feel bad if they chewed them to bits and messed up your house. I learned the hard way, so that's why I know that rule. All right. Well, thank you all for attending. Good luck.
Thank you.